Well, good morning and welcome to the Emergency Services Headquarters in South Australia. I'm joined at this press conference by a large array of very, very important people, starting with, of course, the Honourable Vincent Tarsi, the Minister for Emergency Services in South Australia. We've also got Julia Waddington-Powell, who's the head of SafeCom. We've got Mark Jones, the Chief of the CFS, Chris Beattie, the Chief of the SES, and he's had a very busy 48 hours, and Michael Morgan, who's the head of the MFS in South Australia. This Emergency Services Headquarters has been long overdue. In fact, when we came to government, there had been a report sitting with the previous government for a very, very long period of time. The Emergency Services Headquarters, which was previously in the city, had completely and utterly outlived its useful life. We set about securing in our budget $80 million to produce this state-of-the-art new facility, and I've just got to say, this is amazing. Our CFS, our SES, our volunteers across the state were working in very cramped and suboptimal conditions for a long period of time. They've now got the technology, they've now got the space, they've got a wonderful working environment. Especially important is the new training facilities that are here. This is going to be absolutely vitally important to make sure that we can, if you like, encourage, recruit, train and retain our wonderful volunteers that serve us so well here in South Australia. I couldn't be more excited than to be here for the opening today, and in a few moments' time, after I give the COVID update, answer any questions, I'm sure Vincent Tarsi will say further words, and also you can hear from some of the fabulous people that are leading our emergency services response in South Australia. As I said, I've been very busy. First of all with the CFS, down with the Coles fires recently, and of course with the extreme weather that we've had in South Australia recently. It just demonstrates how much we do rely on our emergency services, and in particular on the wonderful volunteers that we have right across our state. In terms of providing you with just some preliminary information, it's not complete, but I thought this is probably my press conference because I've got, after this Executive Council, I've got to be at Government House for the swearing in of the new Lieutenant Governor, and then of course we've got National Cabinet, so I wouldn't be standing up until much later this afternoon. I know people are keen to hear what the numbers are. What I can report to you is that we have 1,953 positive cases in South Australia in the 24 hours to midnight last night, so slight reduction on where we were yesterday at 2,400. These numbers do bob around, but this is significantly below now the 7-day average. As I said, you will see fluctuations, but the good news is that that 7-day average is significantly reducing. We have, of those 1,953, 1,434 came from PCR tests and 519 came from RAT tests. So I don't have the total number recovered, but I expect it to be a continuation of where we've been in recent days, with more people recovering than are becoming newly infected. Another sign that we're at or now past that peak in South Australia. In hospital, no movement in terms of the totals. Hospitalised still sitting at 288, and a slight increase, 27 in intensive care and 5 on ventilators. I think yesterday it was 26 and 4, so a very small jump in terms of the number of people in intensive care. We are well within our total capacity in terms of intensive care, in terms of people on ventilators, and in people in terms of being in hospitals, both here in Metropolitan Adelaide and of course in our country hospitals as well. So things are tracking well at the moment. We can't be complacent. Our front line for this is making sure that we have people that develop symptoms going and getting that PCR test. There are no lines, there are no delays. People should go and get that PCR test. It's a preference to using the rapid antigen test. I've spoken about this the last 2 days at my press conference. I was very pleased to see it reported, and again in the advertiser today. My strong message to people is, if they've got any symptoms or if they're a close contact, go and get that PCR test. It's far more accurate than the rapid antigen test, and it means if you are positive, you'll be starting your 10 days of isolation much earlier than if the rapid antigen test gives you a false negative and then you don't find out for 4 or 5 days later. So strong message there. And the second thing is around vaccinations. There are just thousands and thousands of appointments available. I don't have the statistics for yesterday yet. They come through with the Australian Immunisation Register, the AIR, later in the day. We'll be able to report those to you. But there are just thousands of appointments available today in South Australia. Go online, book in, turn up at one of our mass vaccination clinics, have that jab, whether it be your first shot, and I am very pleased to see a lot of people having their first and second jabs, a huge number of people having boosters in South Australia, so massive thanks and congratulations. And of course we've got our students going back to schools in the coming weeks, so many of our senior students are due for their second or their booster shot if they're over 18. And of course we have got the 5 to 11-year-olds going absolute gangbusters in South Australia at the moment. I haven't looked for 2 or 3 days, but we were number 2 to Tasmania in terms of our vaccination for 5 to 11-year-olds. And there's more than 1,000 appointments per day available at Wayville just for that paediatric 5 to 11-year-old dose. So hopefully people can get along and get that as soon as possible.
How many deaths recorded yesterday?
I don't have that data through yet.
It's the first day of the limited return to work in the city. Visually, it didn't look any busier than it did from a few days ago. Is there any indication of how many of those 25% public service are actually going to come back, or whether people are responding to the call?
Yeah, well, look, I haven't seen it. It's a bit early to say just yet, Alan, but we are, I think, the first state in Australia to move away from the guidance to work from home, and so we are gradually, in a staged way, improving the number of people in our CBD. The CBD's been hit really hard, so we are encouraging those people, up to 25% of people, back into their offices in the CBD in Adelaide. And we're particularly encouraging them to get out, spend some money with their local shops, maybe some of those shops and cafes and restaurants that they haven't been at for the last 4 weeks with the work from home guideline. So we're very keen to see some increased activity in our CBD.
Mark Maisie was talking about perhaps even going to 50 or 75%. Is there any indication of a timeline even for stepping it up even further?
Oh, look, we're the first in Australia to make this move. Look, there are always going to be those people that want to increase it faster, but our primary responsibility is for the safety of all South Australians, and I think this is a good first step. We'll monitor what happens with this, but naturally we do want to increase the number of people that are going into the CBD, but we want to do it in a safe way. We're strongly advising people to wear masks, even when they're in the office situation. When they're going into lunchrooms, they're going to be encountering people that could potentially be close contacts or COVID positive themselves, and so we are just encouraging people to wear those masks as much as they possibly can at the moment.
We're approaching the Education Union's deadline. Can you give us any indication as to whether you met their demands?
Well, as I said on morning radio this morning, I haven't got any further update. I met with Professor Nicola Spurrier yesterday, and she said that she'd had a very good meeting with the AEU, with the union, on Tuesday afternoon. I think last week they presented us with 18 or 19 demands. I think that have been whittled down to 3 or 4, maybe 5. The major sticking point was the use of rats. But I think Professor Spurrier outlined in a lot of detail why the use of rapid antigen tests not applied correctly could give a lot of false sense of security to teachers. It's a point-in-time test. It's highly inaccurate in terms of giving false negatives. We only really, in our system, accept the positive, because if it is a positive, it's pretty definitely a positive. So we allow that to be considered a positive for people to start their 10 days. But a negative doesn't necessarily mean that you don't have it. And so for all of those reasons, we think it's best to stick to the health advice that we have at the moment.
So you're confident strike action has been avoided then?
Well, let's wait to see. But I don't believe there is any need for strike action in South Australia. The reality is I think we have a very sensible and safe return to school plan in South Australia. We have listened to health advice since day one. That health advice has been provided now to the union. We're hopeful that we can avoid that strike action.
And so if strike action does occur, is there anything more you could have done, or do you say you've done everything you possibly can to allay teachers' fears?
Well, look, the teachers had a long list of concerns. We have addressed the vast majority of those, but the use of rapid antigen tests we just can't agree with the union on. Yes, I understand that some states are using the rapid antigen tests. I can't speak to the advice that they have received. What I know is that our Chief Public Health Officer, the Chief Medical Officer for Australia, and the AHPPC do not support rapid antigen tests for surveillance for teachers. Now, we are going to be providing rapid antigen tests for those teachers who become close contacts, for them to be coming in on a daily basis. We are going to be providing rapid antigen test for those teachers in the very early years, because they are in a very intimate relationship with somebody who could be COVID positive. But for the rest, the health advice is clear, and we're going to be sticking to the health advice.
The AHA is calling for hospitality restrictions to be the next ease. They're saying it's a matter of urgency. Can they expect that they'll be the next booker?
Certainly, we're very concerned about the restrictions and the effects on the hospitality sector and other sectors, particularly in our CBD, but more broadly as well. So I had a meeting this morning with Professor Joshua Ross from the University of Adelaide. We've got another meeting tomorrow. We're just looking at the effects of easing those restrictions. We don't want a significant second wave in South Australia, but we do think that we are getting to that point where we can start to ease those restrictions. I think first amongst those is going to be easing the density arrangements around hospitality.
Does your modelling show that we are past the peak of this wave?
So, to be honest, we didn't discuss that specific point today, but certainly in terms of the curve distributions that we were presented with, it would seem that we are just slightly past that peak in South Australia at the moment.
And home gathering rules will go at the same time as density?
No, look, I don't want to be drawn today on all of the changes to the restrictions. I was asked which would be first, and I think the density arrangements would necessarily be the first. And the reason for that, Alan, is because in terms of hospitality, it specifically relates to jobs as well. I know that the caps in terms of home gatherings can be very annoying for people, but we've got to be mindful when we're looking at easing the restrictions of three issues: the health, the social and the welfare, and also that economic. And from an economic perspective, we know that this is very crippling on many small businesses with having those density arrangements in place, and so that will be our highest priority.
Can I ask your response to a 52-year-old Chapel Hill woman arrested for vaccine deception?
Quite an extraordinary situation that we've just been alerted to. A 52-year-old woman allegedly with vaccination fraud, asking somebody else to go and have the vaccination for her so that she can show her vaccination certificate. This is unconscionable behaviour, if correct. I understand that the police have now made an arrest. I think it's very good that the police got onto this. This is completely unacceptable behaviour, but let's see what happens in the court proceedings.
Premier, just on the wild weather at the moment, how concerned are you about infrastructure and businesses and all that?
Yeah, well, obviously we're extraordinarily concerned about the extreme weather that we've had in South Australia over the last week. With the rains, and we had further rains, significant rains last night. I know Chris Beattie will probably speak to the calls upon the SES, and of course the Minister will talk about the calls on the CFS and the SES over the last, and the MFS over the last week, responding to this situation. I had a report yesterday which showed that the Australian Rail Track Corporation had identified 10 breakages or potential interruptions to the rail corridor in South Australia, but much of the rail corridor still has elements which is covered in water, so we really need a bit more time to get in there and do that assessment. Our focus at the moment is making sure that our roads and our rail corridors can be usable, safely usable again as quickly as possible. We're sitting down with the local government association, looking at what support we can provide. This is really a combined effort, because there are a lot of local roads and infrastructure that are affected, state roads and infrastructure, and of course federal roads as well. So obviously we're trying to get that rapid assessment done as quickly as possible, but the early indications are that there is significant damage right across the state, especially in the north and on the west coast, and we're just trying to prioritise getting all of our infrastructure usable, safely usable, as quickly as possible.
You said earlier that South Australia is doing really well with the children's vaccine, but are you foreshadowing a children's vaccine shortage, supply shortage?
None.
None?
No.
That's
Look,
not going to be brought up at National Cabinet today?
No. Look, the reality is that at the moment we've created 1,000 appointments every day just down at Wayville. You might recall 2 or 3 weeks ago people were saying, how can we allow our students to go back when they haven't been vaccinated? Well, that is no longer something to consider. There is no shortage of the paediatric vaccine, and there are no shortage of appointments here in South Australia. Now, we've made sure of that within our system, which is the SA Health mass vaccination and other clinics across the state. And in addition to that, of course, we have our friends in the pharmacy sector, wonderful GPs in South Australia who are also doing a wonderful job with that paediatric vaccination. So there can be really no excuse for people prior to going back to school that they haven't had at least that first jab. Now, the interval between the two jabs is 8 weeks, so nobody will be fully vaccinated. But what I can say is, whilst we were concerned in the very early days about the effects of Omicron on young people, that just hasn't been realised. We have very, very low numbers in the Women's and Children's Hospital, and to date, still not a single admission into ICU for anybody at the Women's and Children's Hospital.
What are you hoping to get a
Well, National Cabinet today will be focused on national issues, and there are still some very significant supply chains disrupted, especially around people who are in quarantine, either COVID positive or close contacts. You note that we do have a differential arrangement in South Australia. So if you are COVID positive in South Australia, you do 10 days. Interstate, it's 7 days. We believe this is allowing more people to get back to work. If they go back to work too early, they're just out and infecting more people. So we do have a differential arrangement, and we do note that many national supply chains are severely impacted at the moment. It's probably having lesser effect here in South Australia, but nevertheless there are supply chains that are disrupted into our state as well.
Why are you closing mental health beds as part of the COVID-19 response?
It's a temporary response to workforce at the moment. I hope it's only in for a number of days, or certainly not too long whatsoever, but we've got to be mindful of the workforce shortages that exist. I might have reported the last couple of days that we're now below 500 SA health workers in metropolitan Adelaide who are furloughed, including those people that are COVID positive. That's about half where it was 2 weeks ago. So we're making real efforts there. All of those patients that would have been supported by those beds will be found alternatives, and people supported, of course, in the community.
What do you make the latest plans to ban political donations and deal with this?
That's not their plan.
Right,
No, their plan is to ask the Attorney-General to look at some options. And this is what we're seeing now from Peter Malinauskas pretty much on a daily basis. His policies are to call for inquiries. He's doing that with education. He's now doing it with political donations. He's sounding more and more like Nick Xenophon every day. Thank you.
Thank you very much. We're delighted to be here today opening this Emergency Services headquarters. This centre spans over some 5,500 square metres, absolute state-of-the-art technology. For the first time in our state's history, all of our emergency services senior leadership positions will be under one banner. And of course that makes lots of sense, because we've seen in recent times, for example, how much collaboration there has to be, and there is, between all of our emergency services, whether it be our SES or our CFS or our MFS, as well as SafeCom as well. Whether it be in the management of fires or the management of floods, what we've seen thus far is that this centre is certainly handling the heat. It's an $80 million build. It is state-of-the-art in technology. It is earthquake resistant. It also has its own backup power supply should there be ever an emergency situation that requires it as well. We've seen in recent times the response from our emergency services has been absolutely extraordinary, whether it is through battling bushfires in the southeast of our state in places like Mount Gambier and Coles, or whether it be overnight through the much rain and flooding situation that we've had in the north and also the northwest parts of our state. This emergency services headquarters is state-of-the-art, it's purpose-built. There's nothing like this in Australia, and I know it is certainly going to go a long way towards making sure that our state is resilient well into the future. As I said, $80 million, it spans over 5,500 square metres. From the first time in our state's history, all of our emergency services leadership positions will be under one roof. We've been for a bit of a tour this morning, and we've seen a whole range of recent weather events that the emergency services have responded to. I'm here with my emergency services chiefs and also Julia, who's the head of SafeCom in South Australia. So we'd be happy to take any questions. I can take them of a policy or general nature, and if not, I can defer to my chiefs for any technical operational questions as well.
How big is the challenge to clean up
Yeah, so our SES have been extremely busy, along with our other partnering agencies like South Australia Police in recent days, currently working very hard to making sure that they can continue to maintain access to things like rail and roads, especially in the northern parts of our state. And overnight, in fact, we had 107 call-outs by the SES, and 2/3 of those were actually